Hello, I'm Wally Overman, Vice Chairman, Dare County Board of Commissioners, and I also serve on the board of the Dare County Health and Human Services. Pleased to welcome you here today for our ribbon cutting. Please join me in a prayer. Father God, we come before you today with a spirit of thanksgiving. We thank you for this day and the individuals who are in attendance at our ribbon cutting ceremony. We ask that you would continue to bless this building and all who enter it with your guidance and protection. Please look after the clients and patients that enter this building to receive services. Protect our staff members who work in this facility, and may your hand guide the daily work they do. We thank you for this day and this time of fellowship. Amen. Please stand and join me for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Today we celebrate the additions and renovations made to Dare County's Department of Health and Human Services. We are very thankful to many of you who have been with us every step of the way during this project. I'd like to recognize some of the groups of individuals that have made today possible. First, I would like to recognize some distinguished guests that we have, including Betty Jo Shepard from Senator Burr's office. Betty Jo, where are you hiding? There you are. Trey Lewis with Senator Tillis's office. Trey, thank you. And Leslie Ginsky with Representative Murphy's office. Thank you all for making the effort to be here today in such really beautiful weather. So as I said, I'd like to recognize my colleagues on the Dare County Board of Health and Human Services. And as I say your name, if you're in the audience, please raise your hand or stand. Kevin Phillips, Vice Chairman of Dare County Board of Health and Human Services. Nick Kiusis. Dr. Ashley Clower. Dr. James Woodson. Latanya Murray. Dr. Daniel Jones, Alexis Hodges, Doug Tillett, Dr. Mark Grossman, Ashley Jackson, Commissioner Irvin Bateman, I know Irv's here, there he is, Janine Sewell, Alan Moran, and Chris Roberts. I tell you, there's a lot of hands that didn't go up. These are very busy people outside of serving on the Dare County Board of Health and Human Services, so that's a reason. But on behalf of the Board of Health and Human Services, I'd like to extend our gratitude to the Dare County Board of Commissioners. The Board of Health and Human Services is so appreciative of your ongoing, unwavering support of this department. This renovation project is just one small example of your dedication to social services, public health, and veteran services in our community. We are truly fortunate to have a Board of Commissioners that supports our mission of meeting the evolving health and social needs of our community. I'd like to individually recognize our Dare County Board of Commissioners. Please stand again or raise your hand when I recognize you. Chairman Bob Woodard, Commissioner Irvin Bateman, Commissioner Danny Couch, Commissioner Steve House, Commissioner Rob Ross, and Commissioner Jim Tobin. Jim couldn't make it today either. In fact, he's pretty busy in the storm himself. I'd also like to introduce Dare County Manager Bobby Outen and Finance Director Dave Clausen. Unfortunately, Bobby's on vacation this week, and Dave is tied up on financial matters, so they would be here if they could. Also, Dustin Peel, who was the project and procurement manager for the county and was very involved from the very beginning with this project. Dustin, thank you very much. Your efforts here are clear. What you did here is fantastic. We'd like to extend our gratitude to the architects on this project, Tim Oakley, Ann Collier, and Frankie Joyner, as well as our partners at A.R. Chesson, who were responsible for the construction portion of the renovations. Doug Chesson, Al Chesson, and Hunter Davenport. Thank you all. Lastly, I'd like to recognize our staff team that continued to provide services and were so flexible throughout this project. our Health and Human Services Director and Public Health Director, Dr. Sheila Davies, and our Social Services Director, Chuck Lysette. There he is back in a minute. Sheila, did you raise your hand? Okay, all right. Okay, now I'd like to turn this over to Chairman Bob Woodard. Thank you all.
What is this, number 3, Dorothy? In recent months? Golly Moses, we just, instead of hitting a home run, I think the Dare County Board of Commissioners definitely hit a grand slam. It's unbelievable what we've been able to accomplish, and I couldn't thank my fellow board members any more than that. Dustin, I don't know, Bobby overruled you, I guess, with these colors. This UNC blue, I can't get away from it. We need some purple in here somewhere from ECU. Wally, we need a little bit of red from State. It's on the exit. It's on the exit. We're gonna have to talk to Bobby about that, Dustin. So, well, good afternoon, and I want to thank you all for joining us today to celebrate this recently renovated and modernized Dare County Department of Health and Human Services. As all of you here today know, the Department of Health and Human Services plays a very integral role in our community, providing an array of essential services to our citizens of all ages, from nutrition services and health and education to disease control, substance abuse services. Dare County has always placed the importance of protecting the health of those who live here. They even provided me a COVID test. Thank you so much, Debbie, just recently. I thought I had it for the second time. With the growing numbers of people that have begun to call Dare County home and the increased demand of these services, it became evident that there was a need to modernize this facility and department here in Manteo to really better serve our community. I know those who work in this building are elated after seeing what they had to come to work to every single day, and now after these renovations. Since 1999, the Dare County Department of Health Human Services has provided its many programs and services out of 2 separate buildings. As most of you are aware, there were 2 separate buildings here on this campus, one of which housed the Public Health Division and the other housed the Social Services Division. Over the years, these 2 buildings received certainly their fair share and wear and tear, and having been constructed more than 2 decades ago, they had growing increasingly outdated. And we have a lot of our facilities in Dare County that this board is addressing. We're getting ready to address some of our recreational facilities, our public services. We've got monies in the budget for capital improvement projects for these things. So this board is a visionary board. They are a progressive board. They don't react. They provide and they look forward to the future. And I can't thank them for that, having that attitude and doing that. In addition to our growing staff at the health department, to experience overcrowding as they work to provide essential services to the people throughout the county, to solve staff overcrowding issues and to more efficiently and effectively serve members of the community, all in one place. You come right through that door and you can be serviced for social services or health issues, and right here on this campus. I certainly want to echo what the vice chairman said of our board. I want to echo and acknowledge my fellow board members for supporting this. The vice chair, Commissioner House, Commissioner Tobin, Commissioner Ross, Commissioner Couch, and Commissioner Bateman. It was a no-brainer for us. We knew how important this was, and we were unanimous in making these decisions. The vice chair's already introduced the county manager and our finance director, and Dustin is here this afternoon, our project and purchasing officer. He's been phenomenal with all these projects we've had, COA, this, the bridge, I mean, you name it. Dustin's been just fantastic to work with our contractors and our folks and our board. And Dustin, I want to personally thank you for all that you do for the county. In July of 2020, this existing facilities began to undergo their extensive renovations and modernization process. These two buildings on this site were not only updated and modernized to better serve the needs of Dare County citizens, they were also joined together with a 6,500 square foot addition that now serves right here, this lobby that we're in right now, as the main entrance. In December of last year, about a year and a half after construction began, the finishing touches were completed on the project. Now, Ms. Davies kept pushing this back and pushing this back and pushing this back, and for good reasons. And I'm teasing her now, but I'm glad that we did wait so long, Sheila, to make this presentation today, because I think we're hopefully not dealing with so much of the COVID as we have in the last 2 years, but I'm glad we waited and hesitated and stretched this out. By bringing the public services, health division, and social services together and creating one consolidated facility, we've made it possible for our health and human services staff to provide their services seamlessly. This makes the entire process of providing services much more convenient for certainly our clients, as well as more efficient and cost-effective. Merging the buildings provided patients with one convenient check-in location right here in this lobby where we stand. I want to thank you again to everyone who made this project possible, and I want to thank you all for attending this afternoon. And with that being said, thank you again once and all for being here. Thank everyone for what you do. More importantly, I want to thank the staff on both the social services and health. Nobody does it any better. And I mean that sincerely. I've seen it, and nobody does it better. And I hope with this next budget cycle that we've just approved, we'll put a little bit more money in your pocket. We're hoping. So, thank y'all. I will introduce, I don't have to introduce, Ms. Davies, would you come forward, please?
Thank you so much, Chairman Woodard. You kind of brought a little tear to my eye, so we really do appreciate your dedication and support, and we do feel that. One individual that I also wanted to introduce is here, Frank Hester. He's actually a former Health and Human Services board member, and he's currently serving on the Board of Education. So thank you so much for being here with us as well. And one individual who's not here with us today, who had this vision, but he's camping, is Jay Burris, our former Health and Human Services director. This was kind of one of the things that he was hoping for when we consolidated this vision of bringing these two buildings together. So I'm thrilled that we were able to do that. And he actually got a sneak preview tour months ago before I started delaying this. Anyway, so he sends his regards, and certainly we're happy that this facility is here. So on behalf of the 160 Dare County Health and Human Services employees, I wish to extend a warm thank you to our county manager, Bobby Outen, our finance director, David Clausen, the Dare County Board of Commissioners, and the Dare County Health and Human Services Board. Your support, not just with this project, but for all of the work that our agency does, is so much appreciated, and we're so grateful for that. I'd also like to give a special thank you to Chuck Lysette, our Social Services Director. Chuck served as the liaison for this construction project between well, Dustin and the contractor and our staff team. And without Chuck, this could not have happened. I'm not sure how many of you have experience with construction projects, but when you're managing the quantity of people and the communication, and I think it's worth noting, we didn't close our doors at all during this construction project. We operated all of our clinical services and all of our social services, and were available for our veteran services the entire construction project. So, not to mention, you mentioned July was when it officially kicked off of 2020. The pandemic started in March of 2020. So if you think about the call to action that Health and Human Services had during that time to respond to the pandemic, take on more work, adjust work schedules, and then, oh, by the way, we're going to start construction. You know, it's, if you've lived through construction either in your house or worked through construction, you get a feel for what that was like. And I cannot be more proud of our staff team for you all, what you endured. Those of you who heard sledgehammers and nails and, you know, kept your chins up serving your patients and your clients, and the dust, oh my goodness, the dust. Really an extraordinary team that we're blessed with here in Dare County. You know, they say it takes a village, and it certainly does. And our village is our 160 employees for Health and Human Services. It's Dorothy and our public relations team. It's our public works team that's helped us get the inside and outside ready for this. It's a few special people like Willie Spencer and Cameron Thompson, who both received Employee of the Quarters recently for their above and beyond service with the construction project and helping staff. You've probably lost track of how many times you moved boxes and people from one office to a new office to, oh, that's only an office for 2 weeks, and now we got to go to a new office because of the renovation. But I will tell you, every trial and tribulation is worth it. This space is amazing. We are able to serve patients and clients safely, efficiently, effectively, and respond to the growth. You mentioned this facility is just over 20 years old. The population of Dare County back in 2002 roughly was about 29,000. We're about 38,000 now. And so the demands of evolving to meet the health demands and the social needs that our staff is able to do requires space and tools. And the Dare County Board of Commissioners continues to equip us with what we need to do to serve our public. So thank you so much. Thank you, staff. Thank you, board. And with that, it's the moment we've been waiting for, which is cutting the ribbon. So I think we're going to move outside to do that. And so members of the Dare County Commissioners, the Health and Human Services Board, Chuck, and then Willie and Cameron, I think you all are going to hold the ribbon for us.